So good afternoon, everyone. We've got a number of important COVID updates to share today. Before diving into the details, I want to just kind of take stock of where we are in this year-long emergency. As I said in the State of the City on Monday, we can see the end of this pandemic in sight. And Governor Scott yesterday actually kind of charted out what the timeline looks like to its end yesterday in his reopening plan, which really shows that by July 4th, we should be more or less back to normal. But as President Biden said, I think yesterday or in the last couple of days, just because the end of this pandemic is in sight doesn't mean we're at the end. And in fact, the virus remains here, remains around us, remains a threat to those of us. If you are like me, especially if you're like me, over 50, haven't gotten a shot yet, haven't had your vaccination yet, or have some kind of chronic disease that is impacted by COVID and haven't been vaccinated yet, this is a particularly risky time. We see that there is quite a bit of the virus circulating in the community right now, and it may be more transmissible right now than at earlier times in this pandemic. And that's something we got to grapple with and think about and hold those two things in our minds at the same time. We're near the end. We're not there yet. Here's what's going on right now. And we have Dr. Stephen Loeffler with us to help sort this through. Once again, the president and COO of the UVM Medical Center. Dr. Loeffler and I are going to talk about in a moment what we are seeing from our variant testing. I think we're going to get an image of what the testing is showing right now, and it's pretty dramatic. Since we started testing for the variant in February, the variants in February, initially you can see in February, well into February, we had little indication that there was much of the variant around. That started to change over the course of that month. And still, by early March, in much of the city, there was very little variation. What these charts are showing, and it's a little to interpret them, we can now look and see that of the COVID that is being detected at all three plants of our wastewater plants, 50% or more, or maybe closer to 80% in two of the three plants, of the total volume of the virus, of all the virus that we are detecting, 50 to 75% of it is showing indications of these mutations that mean that it is the variants that we're seeing. And now, while wastewater monitoring results can't be used to determine the exact number of cases or the precise proportion of variant cases in the community, the trends are significant, and the trends show that the B117 variant is becoming the dominant type of the virus around. We also, you can see the orange dot on the main plant and north plant, on the east plant and the north plant. That is an indication that we are now seeing the P1 variant, which is the P1 mutation, which is connected with other, could be connected with other variants. And it is still at very low levels, really at the limit of detection. And we've only seen it once, and then it didn't show up in the next test. But it does give an indication, sort of further confirmation, as the state said yesterday, that there may be other types of variants starting to circulate in Vermont as well. So let me pause here and turn it over to you, Dr. Loeffler. Can you remind people what the B117 variant is and what the implications of that are?
Yeah, thank you, Mayor. So the B117 variant was first identified in the United States in December of 2020. It was initially detected in the United Kingdom. And the reason this is an important variant is it appears to be more transmissible. about 1.5 times transmissible as the first COVID virus that was circulating that we all heard about in the beginning. So the big deal with B117 is its transmissibility. It does transmit easier. There is a lot of good news. We do know that all vaccines work well against B117. And we do know the things we've been talking about for more than a year now: masking, distancing, being smart about gathering in groups, washing your hands, all are very effective at preventing transmission. But with 117, little slip-ups matter more because it's more transmissible. It's not surprising at all. It's here in big numbers because, as we've said, it's more transmissible. And viruses mutate. That's what they do. And so when you have a worldwide pandemic with millions of people getting the virus will select for strains that ultimately are more transmissible. And that's what we're seeing now in this country. And for about, I don't know, maybe the last 4 or 5 of these, we talked about the race between vaccination and new mutations. And it's a rapid race, but a variant like 117, because it transmits faster, it can outrun the vaccinations a little bit if we don't get people vaccinated quick enough. And I think that's a little bit what we're seeing in Vermont right now. We have a very transmissible variant in the state, and it's infecting a lot of people right now who are tired of the pandemic, who've had enough, most importantly, haven't been able to be vaccinated yet. I think that's really the key. And so when I see that more than 1,000 Vermonters per day at the Essex Fairgrounds are getting vaccinated, and throughout the state, we have a great program. Johnson & Johnson's here now. It is time for our 50-year-olds and younger to start getting vaccinated, to be able to sign up. That's the key. That's the way out of this.
Thank you, Dr. Leffler. And I just want to kind of go over again, just to lay out what that orange dot up there means. And I don't know if you have, I think we're still all kind of just figuring this out, and I'm not sure if you want to add anything to this, Dr. Leffler, but
I mean, here's what we know. We know there's another variant. I'm sorry.
Well, let me just, I think I just want to clarify, the orange dot does not mean we know the P1 variant is here. It means that we have detected another mutation that might indicate the presence of an additional variant. And our team, led by Brian Lowe, has been working with the Department of Health to determine whether, what this means and what this mutant is associated with. And when we have more updates, we will share more. But we did, I believe, Dr. Levine yesterday shared that the first case, not this, but somewhere else in Vermont, the first case of the Brazilian variant was detected. How are you thinking about the Brazilian variant if that becomes more of a factor, Dr. Leffler?
So we know there's 5 different variants that are circulating across the world, and they're also all in the United States. And you should reasonably expect that any one of them, including the Brazilian P1 variant, could be in Vermont. Because people are traveling, because people are moving around, it's not unreasonable to think that any one of the 5 circulating variants could be here. And the variants in general have been selected by the mutations to be more transmissible. So most of them are more transmissible. That's how it works over time. We have all the data that we have. All the information that we have shows that vaccination provides strong protection against all 5 variants at this point. All the variants, once you're vaccinated, markedly decrease your risk of ending up in the hospital or being very, very sick. And we know that all the variants, it's much harder to transmit them if you're masked and distanced. So I think about the variants as natural evolution of a pandemic. We're seeing what you'd expect to see. The good news is the vaccines that we have work well. That's really, really good news. And the other good news is the things that have kept Vermonters safe for the last 14 months will continue to keep you safe if you keep doing them. So the variants out there aren't easily transmissible when you're wearing a mask and distancing and washing your hands. So I'm a little less concerned about what variants here. I do think the variants show why we're seeing a spike in Vermont right now in cases, but we know how to beat this and win.
So let's just talk a little bit more about those numbers and kind of wrap this up. So there's the, we've looked about this almost every week we've met together. These are the number of cases by day in Chittenden County, and we really can see there we are seeing more cases every day for about the last week than at any earlier point in the pandemic, which is striking. The kind of mixed and less ominous news about that, I think we have some more charts here. When you do an age banded analysis, you can see that most of these new cases are in the 20 to 29 age grouping, which just because the nature of this virus is of less dramatic consequence than the infections that we were seeing at the higher age brackets earlier in the pandemic. It is possible for 20 to 29-year-olds to get very sick and even die from COVID, but it is much rarer in that cohort than in the older cohorts or in chronically ill cohorts. And I think that explains this next graph, which is even though we are seeing a spike in new cases, because those new cases are primarily in that younger age band, we are not seeing a spike yet in hospitalizations or in ICU cases. Those remain relatively stable. Is that how you see it as well, Dr. Loeffler?
Absolutely. And this graph is a great graph because if you follow this graph, you can see, at least 4 different spikes on there of COVID. And in the first 3 spikes, as you see the case numbers of COVID go up, you see hospitalizations go up across the bottom there. But in this spike now, even though we're having a lot of cases, we're really not seeing that same overall spike in hospitalizations. So what it shows is that we've gotten a lot of vulnerable Vermonters vaccinated. And so they are not getting sick and requiring hospitalization. And it shows that as more and more, in that last graph, you show all different age groups now that are mostly vaccinated, like 70 to 79, 85% of Vermonters have been vaccinated. They're not catching COVID right now, even though there's a lot of COVID out in our communities. So we are in good shape right now from a state perspective in terms of hospital capacity. At the medical center, we have 12 COVID patients right now. We got down to as low as 7 one day last week. We've ticked up a little bit. But in general, even though there's a pretty big surge of cases in Vermont, some of the days last week we had the most cases since the pandemic, hospitals haven't matched that growth, which is amazingly good news.
So let's sort of wrap this all up, summarize it all up. What is this? What should this mean to Burlingtonians? Here's how I'm thinking about it, Dr. Loeffler. Before you go, maybe you can reality check this or fill in anything if I don't have this right. It seems to me that over the next few weeks, if we are in a period where we need to continue to try to avoid any more unnecessary, potentially debilitating infections until more of the community is vaccinated. So this means, I think about if there are activities that you maybe are higher, that have some risk in them. Think about that, whether you want to be doing them between now and when you're vaccinated. I've been thinking, I've been going to a regulated gym for recent months, and there's been no infections there. But I got to say, I'm a little nervous right now with this variant out there, and just would hate to get sick here when the end zone is in sight. So I skipped the workout today, and I may skip a few more until I get my first shot sometime next week. I think first and foremost, if you're eligible, get on the website and get yourself signed up for a vaccination if you can. As of, there were everyone over 40 can sign up now. As of Monday, that's going to be up. I think there's another age band that comes into play, and by the 19th, everybody can sign up. And I think we have more on that in a moment. Also, until you have been vaccinated, remember there's still this possibility of getting tested out there. There's a lot of testing capacity in the community, including at 405 Pine Street, the site that the city has helped set up. and it is available to folks if they want to get tested regularly, even if they're not there's no particular high risk reason to get tested. You can go and get tested regularly until your household is vaccinated. um, Olivia, you have a couple more here. Face coverings is another thing, of course, to remember. We like to push and talk about here that we think there is a difference to using high quality face coverings. If you have one of these more substantial masks around, like the city masks, following the state restrictions on gatherings, those gathering restrictions remain in place. They are going to be eased up in the days and weeks and months ahead, but stay consistent with what the state is promoting. HVAC systems. So, it frustrates me. I go into some establishments and, don't see the HVAC, the air purifiers operating, even though they are there. We should be using them right now. And also, we're now into the time of year where people can be opening their windows and improving ventilation in that way on many days. And I think that's what, and then of course the vaccinations, which we spoke to before. And we wanted to add here, remember, and this is a little bit confusing, I don't think everyone has their arms around this. There's the state website, healthvermont.gov, my vaccine. That does not have all of the opportunities on it, however, that the individual pharmacies, Walgreens, CVS, and Kinney Drugs, I believe Kinney Drugs is on the state site, but the Walgreens and CVS are not. And you kind of have to search separately through those systems. And the information, the availability there changes all the time. So it is definitely worth checking back at those sites, even if the first time you go there, you can't get an appointment. I've been able to move up my first appointment by 10 days by checking back in, and we really encourage people to do that. How's that, Dr. Leffler? Anything to add to that?
So Moreau, the way I think about this is we're in the fourth quarter of this game. Victory is in sight. Like, we can see the end of this thing. And I think you and both the governor have outlined a good game plan to get us to the end. What I really want to tell people is, for 14 or 15 months now, a lot of Vermonters have made a lot of sacrifices to keep themselves safe, to keep their loved ones safe, to do really the right thing to try and prevent this. And in the fourth quarter here, the virus is trying to make a comeback. It's working hard with variants to be more contagious. But with just a little bit longer of people doing the right things, we can win. And you can be safe, your loved ones can be safe. And here's the good news. We're at a point now where the weather's beautiful. If you don't want to go into your gym right now, go for a walk, go for a run, go out on the bike path, have an outdoor lunch with somebody. Don't eat inside. Yes, please keep wearing your mask. Yes, please keep thinking about not gathering in closed spaces. Because very, very soon, once you're all vaccinated, we're all vaccinated, we'll be able to go back to those things that we love. Don't give up in the fourth quarter is really my big advice here. You've made a big sacrifice. Don't lose the game right here at the end because you're tired.
Well said, Dr. Leffler. I want to even actually, let's not use any sport. I know sometimes this gets tired, but I almost feel in this case, it is appropriate to use the wartime analogies as opposed to the sports analogies. And what we're talking about here, I think we all know through history somehow those deaths that have happened at the end of wars, after peace treaties have been signed, after the war is essentially over, but information doesn't get out, and there's more tragedies when the outcome is already determined. That's sort of where we are here. This pandemic is coming to an end, but if you make a mistake here at the end, there still could be more death and tragedy, and the tragedies are so upsetting. The Times today published a piece on loss, and just it's worth remembering what's at stake here, folks. It's still a deadly virus to some. Don't let yourself be one of the final tragedies here.
Yeah, just to be clear, to emphasize what you just said, even though there's a lot of good news on this, what we're talking about today, we still have very sick people in the hospital who have COVID-19, who are fighting for their lives. So people are still getting sick with COVID. So wartime analogy is probably better, but whatever, stick it out here until the end. Keep yourself and your loved ones safe.
Very good, Dr. Leffler. Thank you, and we'll have you back again soon. Um, two more topics we'd like to hit, and then we're happy to open it up for questions. I want to speak to what is going on right now with Burlington bars. I know since the state changed the regulation on this, I think in the last couple weeks here, we've gotten a number of questions that we'd really like to speak to. So on March 19th, the state announced that beginning March 24th, all bars and social clubs would be able to reopen. Um, However, and this point sometimes is not focused on enough, that bars and social clubs can reopen under the rules that were already in place for restaurants. And um, the city did have the opportunity, as have other municipalities, to put even more restrictive measures in place on bars. However, up until now, we haven't done so, and I don't think any other municipalities in Vermont have done so for two key reasons. First, um, again, the requirements that currently apply to bars are the same as those that apply to restaurants. So, in some sense, what the governor has done here is consistent with what the city did earlier in the pandemic when we put earlier closing hours in place for the bars. That's one of the additional rules that to operate like a restaurant, the bars currently have to follow. So um, uh, this is not. It's, I think, really important that people understand that this is not bars just being allowed to operate, um, without rules in place, and something that looks like pre-pandemic times. Second, and very importantly, according to the health department, there have been an extremely low number of instances of COVID-19 transmission between customers and staff in restaurant establishments that were following the detailed guidelines that the governor has had in place for months. And so there's a lot of reasons to be confident. This is why the Department of Health is confident that restaurants and bars can operate safely with these rules in place. I have repeatedly asked the Department of Health to inform the city if this changes in any way, if because of these variants suddenly these precautions are not enough. We want to know, and then we want to be able to take further action if needed. And I've received assurances from the Department of Health that they will let the city know if there is something that changes in the data. And up until now, there has not been a change. So for all these reasons, the city is not planning at this time to add new regulations to the bars that are operating in Burlington, but we are continuing to closely monitor this situation, and we'll reassess if anything does change. Finally, I want to speak to BIPOC clinics again, and just give a brief update on the clinics that have been running here in Burlington. This past Saturday was the third BIPOC vaccination clinic that has been hosted here in the city of Burlington, and there have now been 801 people vaccinated at those three clinics. There is another one. There are more coming up. In some ways, helping to support this clinic has given the city really a new model for how we are partnering with community organizations. Specifically, the city is not running this clinic. We are following our partners' lead and leveraging the city system to fill in gaps when the partners ask for help. So, for example, there are about 1,200 calls for the BIPOC clinic sign up over a 2.5-day period. The city was able to, these were people calling to try to register for the clinic when they first began 3 weeks ago. The city was able to activate our call center and pull 14 employees from 7 different departments in to help support this and get people registered. Then we have been able to sort of step back as this has evolved, and that kind of need hasn't been there anymore. So we really want to recognize the Vermont Professionals of Color Network, Vermont Racial Justice Alliance, Winooski Strong, the Black Perspective, UVM's LEND program, and the New Alpha Ministry Baptist Church for their leadership of this work and for working with the city in this way. With that, Brian Lowe, our COVID-19 leader, is here to help answer any questions that might come up today. Brian, did you want to add anything to that before we open it up?
No, Mayor, nothing further from me.
Okay, great.
Thank you.
So, Olivia, do we have any questions from the media?
Yes, we do. First in the queue is Ike from WCAX. Ike, you should be able to enable your microphone.
Mayor, can you hear me?
I can, Ike. Go ahead.
Thank you. Good afternoon. Appreciate it. Following up just on the restaurants, you mentioned this before. It's obviously been a few weeks now since they've gotten the green light. You pointed to the science in past press conferences for the low transmission rate. For you to bring this up again, were there concerns from the community? Were there complaints of being open too late or anything? I guess, is there anything to point to addressing this again today?
Thanks, Ike. Yeah, I guess I wanted to speak to it again. We have gotten emails. I have seen from some Front Porch Forum posts really kind of questioning these two things. I mean, I think I understand the discomfort that constituents have articulated. You know, we are clearly in a time where infections are spiking. They are spiking amongst this younger age band that is more likely to go to bars. Why are we loosening restrictions in the middle of a spike like this? And that is why I wanted to speak to it again. I want to make sure that anyone who has that concern understands that the significant restrictions that bars are operating under, and I want Burlingtonians to understand how closely we are monitoring this and the repeated assurances that we have received from VDH. I just want people to understand why we are taking the posture we are given what is going on, and that's really the reason I brought it up.
Understand. Are any establishments found to be not in compliant? I just want to follow up with that.
We're not aware of anyone who has been cited recently for non-compliance. There have been early in the pandemic. There were some issues with non-compliance. I think at this point, everyone knows what the rules are. I think a lot of the customers understand what the rules are. And if there were to be reports and problems with non-compliance, that's another thing that could cause us to change our posture. So far, we have not gotten those reports or citations.
Thank you, Mayor.
Great. Next question is from Katya. Katya, you should be able to enable your microphone.
Thanks, Olivia. Yeah, I'm wondering if you could speak a little bit more to the P1 variant and like what exactly we can draw from the data there, and that's for the mayor or for Brian.
Yeah, I'm going to turn that over to Brian. Thank you, Katya.
Hey, thanks, Katya. So we did detect a new mutation in the city's wastewater and worked with VDH to try and identify which variant that mutation could be associated with. There's a number of possibilities about what we could have picked up. And what we picked up is really at the limit of our detection. As the mayor said, we saw it and then we didn't see it on our next test. We should be getting our next test results back either late tonight or tomorrow. Sometimes they're delayed, but certainly later this week. And that will help us, because we're going to test for some additional potential mutations, that will help narrow down what it is that we're seeing. So that particular mutation is associated with a number of different variants of concern. And that's why I can't give you a specific answer yet. It's not associated with the B117, although there are some cases where B117 strains have evolved to show this mutation as well. So it's something we're working with VDH on to identify, but we can't tell you definitively which variant it is yet.
And Brian, if I can just jump in here before Katya gets back in, could you explain for people the difference between a mutation and a variant and what that means?
Yeah, great question, Olivia. Thank you. The wastewater system that we have can see mutations on the spike protein of the viral RNA, the ribonucleic acid that's in the city's wastewater. What we don't do, what we can't see, is the actual genomic sequence of the viral RNA. So we can't do the kind of specific analysis of a specific test specimen that VDH, the Department of Health, does with certain samples that they take and send to Massachusetts for testing. So we can see these mutations, but we don't see the entire viral RNA structure. And that's why we know that that there's something different happening, but we don't know specifically what it is yet. And let me know if it's helpful to explain more there, Katya or Olivia.
I think I'm all set. Thank you so much.
Enough wastewater for you. Okay, thanks, guys.
Great. And I think that is all the questions we have today for members of the media.
Great. Thank you, everyone, for joining us. Thank you, Brian, Dr. Loeffler. We will be back again soon. Take care, everyone. Stay safe.